Welcome everyone to Self Principle. As always, I'm Dr. Hashmi. Now today we're going to talk about how you can add 12 to 14 years to your life by simply following 5 simple lifestyle factors. So with that, let's dive into the research and so you can start making those changes right away in your own life. What's interesting when we look at the United States is the US is considered to be the 8th wealthiest nation per capita in the world. But that being the case, what's a little bit sad and creates a lot of hope and opportunity for us is the fact that when you look at all of the countries around the world, the United States ranks 53rd in the world for life expectancy at birth in the year 2015. 53rd, despite having all this abundance of resources. In addition, not only do we rank much lower than other countries, we spend so much more money on healthcare. In fact, we are first in the world for health expenditures as a percentage of GDP. 17.1% of the gross domestic product is spent on healthcare expenditures. Now, given that we spend so much money on healthcare, you would think that we would have some pretty high life expectancy. Now, that's not to say that life expectancy hasn't been improving. If you look at 1940, the average life expectancy was 62.9. Fast forward to 2000, it's improved to 76.8. And in 2014, it's improved to 78.8. That being the case, we still lag behind a number of other developed countries. Now, that's not to say we haven't had improvements. There's been a number of improvements from things like living standards, all sorts of new medical treatments that have come out that have really helped people to live longer. And there's been reduction in smoking as well. But on the flip side, some of the basics that we used to think about a lot have sort of lost way, and the obesity epidemic continues to ravage so many of us, along with the fact that we're just simply not moving like we used to do in the past. Now, in a meta-analysis that was done back in 2012, and this was looking at 15 studies, over 500,000 people, 17 countries, what they showed was that 60% of premature deaths could be attributed to simply 5 unhealthy risk factors. Those 5 unhealthy risk factors or lifestyle factors is what we're focusing on today. They are smoking, excessive alcohol consumption, physical inactivity, meaning you're just not moving as much, poor diet, and obesity. So those are the 5 big things we're going to look at. There's a recent study that was published in 2018 in Circulation, and in that one they were really looking at what is the impact if you were to do all 5 of these lifestyle factors. What would that affect your overall mortality or overall longevity? So in this particular study, they were looking at 2 of the big studies that have been going on. First is the Nurses' Health Study. They had about 78,000 people in that. The other one is the Health Professionals Follow-Up Study, and they had about 44,000 people in that. Both of these studies have been going on for a long time, so they have 34 years of follow-up going on. And once again, they were looking at 5 low-risk lifestyle factors. So here we go again. 1, never smoking. 2, having a BMI that was between 18.5 to 24.9. That is the ideal range where you want to keep your body mass index. Another thing was exercise. You want to aim for 30 plus minutes per day of moderate to vigorous physical activity. Now, moderate to vigorous can be any activity that you find enjoyable. You can walk briskly, you can swim, you can bike, you can play tennis, whatever kind of sport works for you. Then for alcohol, they actually define it as moderate alcohol intake. That was defined as 5 to 15 grams per day for females and 5 to 30 grams per day for males. And then lastly, it was high diet quality score. They used something called an alternative healthy eating index. Now, what AHEI or alternative healthy eating index is it basically gives scores to all sorts of things that we do. For example, if you are eating vegetables based on the servings per day you're doing, you get a certain amount of points for that. And what's recommended is 5 servings per day. Fruits, in terms of servings per day, it's recommended 4 servings per day. Nuts and soy protein, they recommend 1 serving per day. Ratio white to red meat, they recommend 4 servings or 4 times the ratio being more white meat than red meat. Of course, here at Self Principle, we advocate a whole foods plant-based diet, and we feel that going more towards plants is actually healthier for the environment, it's better for the planet, it's also better for the animals. But in this particular one, they're looking at more of a ratio of white meat to red meat. In terms of cereal fiber, they were looking at 15 grams per day. And then in terms of trans fat, they were looking at to be less than 0.5 as a total percentage of energy going on. And then other stuff was things like alcohol, how many servings per day you were doing, and taking all of those things together, they come up with a score. So the way this study was looking at it is they were looking to see if you fell in the top 40% of the alternative healthy eating index. So there you have it, 5 factors: not smoking, BMI 18.5 to 25, 30 plus minutes of exercise going on, moderate alcohol intake, and being in the upper 40% of the alternative healthy eating index. So if you had all 5 of these low risk factors compared to if you had none of them, what the data showed, and this is a long-term follow-up study, what the data shows was there was a 74% reduction in your risk of dying from all causes, 65% reduction in your risk of dying from cancer, and 82% reduction in your risk of death from cardiovascular mortality. All of that could occur not by some magic pill or anything else going on, but by simply following 5 easy to do, low risk lifestyle factors. Not just that, but what about longevity? Well, what they found was that if your life expectancy at age 50, so you've made it to 50 years old, if you were 50 years old and you weren't following any of these low risk factors, then your life expectancy was about 29 years for females and was about 25 and a half years for males. But if you flip that around and you said at age 50, you were adopting all 5 of these low risk factors, what would happen? Well, your life expectancy at age 50 would increase to 43.1 years for females and 37.6 years for males. That is a substantial increase when you think about it. In other words, on average, you were looking at an extra 14 years of life for females and an extra 12.2 years of life for males. So if you're sitting there and you're listening to this video so far, the big stuff here to take away is that these 5 things can be easily done, and the return on investment is better than just about anything else we have out there. And some of the biggest reasons for why they were seeing this longevity or increase in how long people were living, in female, it was really because they attributed about a third of that increase in life expectancy because their heart disease rates went down. And about 20% of that also was because their cancer rates down. Those were the 2 big drivers for why there was a longevity increase: lower heart disease and lower cancer. For men, it was actually very simple. It was 34.1% of the life expectancy gain was due to less heart disease, and 22.8% was due to less cancer. Remember, heart disease and cancer continue to ravage us, and these 5 simple steps can actually make such a dramatic difference in terms of being able to live longer. Now, keep in mind, as you think about the study, there's limitations. It's self-reported lifestyle. So sometimes people could be just saying, I do all of these things, when they might not. It's correlation. It's not causation going on. And of course, there could be all sorts of technical or confounding variables. What kind of medications were they on? Did they have other medical problems that maybe they didn't tell the investigators? So there's always a chance. But the bottom line here is that a healthy lifestyle can reduce your risk of dying both from cardiovascular disease, from cancer, can increase how long you live. And all it takes is 5 low-risk lifestyle factors. Once again, they are: stop smoking, or if you haven't started, don't start in the first place. Keep a healthy weight, a BMI of 18.5 to 24.9. Exercise 30 or more minutes per day, moderate to vigorous physical activity. Make it a point, 7 days a week, you got to move. Alcohol, cut back on it. Moderate alcohol take, 5 to 15 grams per day for females and 5 to 30 grams per day for males. Lastly, aim for a whole foods plant-based diet, and if you're not quite there yet, it's okay. The Alternative Healthy Eating Index was a guide that basically says eat more fruits, eat more vegetables, eat less meat. I'm sorry, specifically less red meat, because they were comparing white meat to red meat. All of those things are key. So 5 very simple things you can start doing right now. If you haven't started, what are you waiting for? Thanks so much for joining. I'd really appreciate it if you could go ahead and hit that subscribe button, hit that like button, and I would love to get your feedbacks on this video and other topics so we can continue to provide you evidence-based information for the future. Thank you.